In terms of adaptation and response of the health system to climate change, there are multiple levels of discussion. One is the most important one is to establish and to invest in universal health coverage. Because if you don't have a resilient health system that is able to take the shocks and the blows that are going to come from the global warming and the climate change, if you have a health center in Malawi that is not capacitated to take care of cholera outbreaks, and they are going to be more frequent, then you need to capacitate the primary health care to be ready for these more frequent outbreaks. And capacitating that means having the right health workforce that understands the new shocks and the new risks that are going to come. That means that we may need to adapt curriculums of health workers to understand the impacts of climate change. That's a practical thing we need to do. The next thing is that we need to also review the way we provide supply of health products and technologies. What is the future going to look like? What health products and technologies are going to be needed at primary health care that were not needed before because of these changes? We need to think through that, and we need evidence. And therefore, there is a huge agenda on research, understanding vulnerabilities, understanding what this is going to mean for provision of health at primary health care level. That research is part of what we need to do in terms of adaptation. To capacitate the health system, it is actually to understand the vulnerabilities, early warning systems, for the health system then to be built to be resilient for the future blows and changes that are going to come that we can predict because of global warming. But finally is also to ensure that the health system is in itself is built to mitigate against further greenhouse gases. So we are looking at, for example, health facilities that are solar powered. We are looking at health facilities that are paperless, that are moving towards the digitization of health facilities, but also in areas that are prone to frequent flooding. It is to build health systems that are resistant to extreme weather, because we have seen health facilities being carried away by floods. We had an example in Uganda where a hospital of 150 beds was carried away by floods. So it's also about what is the future health infrastructure going to look like. Of course, we know we are offloading a lot of care onto digital platforms, but we'll still need facilities. But what does a climate, extreme weather health facility look like? Our realization across the continent of Africa, generally, because that's where we are working and that's where we are focusing on, is that not many governments have paid attention to the oncoming danger of climate change on health. How do we know so? Because on reviewing the nationally determined contribution for many countries in Africa, you find probably less than 20% have any health mentioned in the adaptation section of their nationally determined contribution. That tells you that is not actually an area of focus for them. The second thing we've seen is when you talk to governments around formation of governance platforms for climate change, you expect that the ministerial committees which governments have created to respond to climate change would include health in them. In some countries that have best practice, we've seen health actually is deputizing the ministerial committees on climate change because it's central. But in Africa, we don't have that. We have actually, in my own country, in Kenya, the ministerial committee on climate change the Minister of Health is not involved in it at all. There's no health in it. When you talk about, so what is the health adaptation approach to accessing funds in the Green Climate Fund? Zero. So most of the green climate funds in adaptation to countries are actually going only to irrigation. They are going to flooding control. None of them is actually going to building resilient or climate resilience health systems. So we need to create and to advocate within governments to support them to understand, because it's not because they don't want, it's that there is no understanding of it. And this is why in our approach we also want to make sure we generate evidence for the impact of climate change and global warming on health, so that we can inform governments' national determined contributions and their own national planning, so that we can protect the health system against the coming threats of climate change, which actually is now, failed climate change mitigation, I would say, is the world's biggest threat of the future.